I had one little patient that came. He wasn't quite 3 yet. And when he first came to us, he just could care less about the world around him. He was just totally into himself and just not engaged with anything, even his family members, just very much in his own world. Diann came along at just the right time, and we noticed he actually kind of was interested in the dogs. So first we just started trying to get some eye contact, so establishing some of that joint attention. So we were noticing that he enjoyed playing ball with the dogs and actually would track visually the dog and the ball moving across the room. So then Diann had a great idea that she would hold the ball next to her face. So in looking at the ball, he would again also make eye contact with her to engage in actually participating in the early stages of making a request for playing with the ball. So then we kind of took that and bridged to the use of the Picture Exchange Communication System, PECS. And again, Diann went to the training and was trained in using that. So that was wonderful to have. If you are familiar with PECS, it's great when you're starting that to have 2 people. So it was great to have her and the dogs. And so we taught him how to initially pick up the card, reach, and release it. And it didn't happen overnight. It's a good thing we had 6 years with this little guy, because it took quite some time. But he initially figured out that he liked what he got to do with the dogs, and it was more fun for the dogs to do things than he had playing with a toy himself. So we continued with the use of the ball for a request for him to move towards phase 2 with distance and persistence. So we would move the book around the room and he'd have to find it. And again, this was huge for him to be able to make eye contact and follow things and track things and really engaged in an activity. Then we introduced picture discrimination. So we decided that he liked doing tricks with the dogs. He liked the tennis ball, of course. So we decided to start pairing those items, and then he would have to make choices and make correspondence checks so we knew what he was picking was really what he wanted and what he was paying attention to do. Eventually we were able to move up to phase 4 of PECS, which is sentence structure. So introducing the use of the sentence strip. And again, Devin was motivated with using the dogs for tricks. So he was able to use I want. Devin really liked having the dogs speak to him. So Diann would record things on the switch. So he would request I want touch. So the dogs would do the touch of the switch and then communicate with him. He thought that was the greatest thing. During phase 5 of PECS, we were actually able to introduce some attributes. So Devin would choose the color of ball, the size of ball, the shape. We didn't get an opportunity to spend too much time doing these, but he also got to choose what body part to throw it with, and sometimes even actions to do with the ball. So this was a great way to build the vocabulary as well. And again, without the dogs, it would not have been nearly as exciting. He was just totally cued in and just motivated every session to participate. If Diann was ever not there and sick, I was scrambling trying to figure out what I was going to do to get the dogs or get Devin to participate in what I needed him to do that day. Eventually, we were able to bridge what we had taught Devin with using PECS to actually using an iPad. We used the Prolocodago application and actually were able to then bridge what he had learned in making sentences to make sentences on the actual iPad. One of Devin's favorite activities with the iPad and the dogs was, of course, playing Tea Party. I think he liked listening to the Teapot song just as much as he liked the dogs, but they had a great time and it was always just a fun day, and that kid could have done it a million times and still wouldn't have been bored. So we're very appreciative of how much progress I was able to see my patient make just in those 6 years and with the use of the therapy dogs. The joy on Devin's face when he knows he was able to be successful in telling the dogs what he wanted to do, that was just priceless. He had the biggest smile and just warmed all our hearts. So we are very thankful for Diann, Prairie, and Ovell. Another fun thing that we've gotten to be a part of since Diann and her therapy dogs have joined us is doing little plays with our patients. And we have, with the help of Diann, taken a storybook and modified it and made parts for the children. And I'm usually the one that comes up with some sort of little song to sing during our play, something very repetitive, but the dogs are the center of attention. However, they are what make the kids participate, and it's been amazing what these children will do in front of their parents, having the dogs there to kind of showcase and take the attention and pressure off of them and onto the dogs, and it's been amazing to see how well they've participated and how much the families just are in tears because they've never seen their child do those kinds of things. They're not the typical children that can do the ballet recitals and the programs at church, but they can do a play with the dogs.
Aside from helping us learn how to button our shirts and to zip our jackets, they help us brush our teeth. They also help us learn how to use a knife and a fork to cut up snacks. But aside from self-care, the dogs are also very motivating to help my patients be motivated to try something challenging one more time. For example, I have a patient who is unable to, he has a very high level of energy, and he's unable to tell that on himself. So we used the dogs to demonstrate that. So for example, when Prairie was going to get one of his favorite race cars, he gets very excited and animated and runs around and jumps. And this was a good example of how my patient reacts oftentimes during typical settings and typical days. So this was good for him to see externally and give him feedback as to how he reacts. We were also able to use Prairie in that same example of showing how to be attentive and to sit quietly and to be a good listener. And so he was also able to model that.
The dogs help both me and the patients. They're really strong motivators, so when I'm working on mobility with a child, whether it be gait training or riding a tricycle or a bicycle, the dogs can run out in front of the child and the child can chase them, so they're really motivated to move. They have something to move towards that moves faster than they do, and they can catch up with them and have a good interaction. Also, it's really helpful because the dogs will model an activity for the child or take turns with the child or both, and it turns it into a really playful activity, and the kids are excited to see what the dogs will do, so they'll perform for them. And also the child will definitely move farther, faster, and continue longer when they're working with the dogs. It's a more playful environment, and so the performance is higher.
I would say that there are obvious things that dogs can do with me and my patients. Some of those things are as simple as having the patient throw a ball to the dog, which is a natural activity for a dog, but that motivates my children to throw more accurately to a target or to throw further, for instance. And other things that are obvious that dogs might help with would be just walking with the dog on a leash. But these particular dogs have other skills that go beyond the typical skills of a typical dog. I've had patients who have used the dogs for imaginative play, for instance, doing dress-up time or doctor play, where I will position the child in a posture that's working on balance or strength, and then they are distracted by the dog and can focus more on play than the work of that posture. I've also had a child that was reluctant to walk backwards, that I was able to use the dog as a resistance therapy by putting them on a scooter board and having the child pull the dog against resistance, the weight of the dog, while walking backwards and being able to be motivated by the dog while they were looking at the dog. Another situation I had was a child who was ambulatory but otherwise wheelchair transported, we used the dogs as a motivator for her to walk greater distances by putting the dog in her wheelchair and having her push the wheelchair with the dog in the wheelchair, with supervision, of course. But that was a great motivation for her to push a resisted object and to work on upright gait and posture and endurance for ambulation.
Well, not only do the dogs work with the therapists and the patients, Diann and Prairie and Ovell put on programs and workshops for the kids. Some of the things they do are, we do a play with our Jumpstart kids every year, and the dogs are incorporated with that. And it's a really nice, fun way for the families to get to, one, see what their children are doing, which is always great, but two, have them really understand and appreciate the types of things Prairie and Ovell are doing to encourage their kids. A lot of times our children don't have the opportunities to do things that typically developing children get to do, and so this may be an only chance for them to be able to be in a play or have a tea party with their parents. And for some parents, that may be their only chance they'll have to be able to do those things with their child. And it's really kind of an important milestone in every kid's life to be able to have one of those moments with their families. And I can think of one example in particular. We had a child here, and she was very physically involved. She was blind, cortically, visually impaired, didn't have a lot of opportunities outside of the clinic, and her grandma drove probably 2.5 hours to come see the play that she was in. And I can remember coming up to me afterwards in tears and just saying, you know, I never ever thought I would ever get to see Maddie be able to be in a play, which was a really special moment for her, and I think for the parent. So, you know, and I always think about that because that parent ended up passing away a couple weeks after that play. And that's always the one thing I thought about was, well, she had that moment with Maddie, and so that was very special. So, you know, it's things like that that Ovell and Prairie and Diann add to the clinic, that little special something that they don't get anywhere else, and they probably wouldn't get outside of, you know, in their classroom. So I think it makes it feel more like, I don't want to say normal experience, but more like an experience that other families get to have with their children that normally they don't get. As far as ADLs go, we've used the dogs to teach children how to do toothbrushing. So they'll learn how to brush Ovell and Prairie's teeth, and then they get to take a turn and brush their own teeth. And then... Do
they use the same toothbrush?
They never use the same toothbrush. They use different toothbrush and different toothpaste. But, you know, I think part of the reason is a lot of our kids have aversions to those type of activities, so it makes it feel safe. And if Prairie and Ovell can do it, then they can do it, you know, and it's a fun way to learn. Same with haircutting. You know, a lot of our kids are afraid to go to the barbershop and get their hair cut. So Prairie and Ovell get their beauty shop kit out, and the kids get to play with that and, you know, use some of the tools, pretend to use some of the tools, and then, you know, we gradually get them to a point where we can comb their hair or put rubber bands in there or whatever the aversion seems to be. And it's a nice way to bridge that gap between, you know, just doing that on themselves or on a doll. It's a, you know, a living thing, has a reaction to what's going on, and so it makes it feel much more safe for the kids. I mean, we've done the same thing with dressing skills. The kids have put socks on the dogs, they've put clothing on the dogs. We dress up for the tea party and they all wear hats and dresses. So, you know, it's just a fun way to bring some new skills in. As far as sensory, children who have sensory issues, we've used the dogs, you know, whether it's just even petting them or brushing them or getting them to play in different mediums with the dogs. Right now we're doing outside where we're playing in sand and bubbles, and the dogs get in and do that with the kids too. So for those kids who don't like to do that, when they see Prairie and Ovell do it, then they'll try. It'll be a little bit safer and they'll attempt to do it. And a lot of times it's a lot more successful than when we utilize different activities. When the dogs come and do it, they'll do it.